All right, guys, let's file in. Now, for this next session, we'll be taking a look at the hospital system's pricing practices. We'll be joined by Cynthia Fisher, founder and chairman of PatientRightsAdvocate.org. And to moderate the conversation, Rachel Coors, Washington correspondent at STAT. Now, as they take the stage, we have a message from a rather special patient advocate on the topic. If you guys are filing down, you guys might want to see this. Now, y'all thought Mark Zuckerberg was the biggest name you'd see on the STAT Summit screen today. Nah, we got one more celebrity. So get comfy in your chairs, relax, and lean back a little.
This is Fat Joe sending my love to everybody at the STAT Summit in Boston. It's so important that we solve the critical issues in healthcare right now. And the one I'm most passionate about is demanding prices and transparency from our hospitals and insurers. At Power to the Patients, we are shining a light on the devastation that healthcare is doing to families and communities all over the country. Thank you for joining us in demanding prices and transparency in healthcare.
Welcome, Cynthia. Thanks so much for being with us today. And just for everyone who hasn't heard about Cynthia, she is a biotech entrepreneur and is also a board member of the Boston Beer Company. And she also founded a nonprofit, and she's been advocating for price transparency in the healthcare system and convinced the Trump administration to, by the force of sheer will, implement new regulations forcing hospitals and insurers to disclose their prices for the very first time. But before we get into all that, Cynthia, can you tell us how, connect the dots? How did you end up working with a rapper named Fat Joe?
Well, it was through contacts that I had from the entertainment industry that introduced me to Joe to join our movement. And the first night I met him was over dinner. And as I waited for him to come down the elevator, I turned to my colleague who said, you know, Cynthia, Joe is ideal to work with us because he can bring a voice to the voiceless. And when we sat down to dinner, we each shared stories of people in our lives that had been overcharged, egregious overcharges, and faced financial ruin from healthcare. And he turned to me and said, Cynthia, I really want to be part of this. I believe that I can be a voice for the voiceless. And in that moment, I knew we were going to work together on this issue.
Of course. So tell me, you've spent so much of your time, years of your time and your resources investing and advancing policy on healthcare price transparency. But how did you develop a passion for that issue specifically?
Well, I had been an entrepreneur in healthcare, and I came from the tech sector. So in tech, having automated hospitals and insurance companies to talk to each other, 40 years ago, we always learned that any innovation needed to be better, far superior, it needed to be far easier to use, and it had to be more reliable, easier, and at a far lower price. And I brought my phone on stage because with our phones sitting in this room today, when I started with IBM in the very beginnings of my career, I was selling mainframes, and they were $2 million. And we have far more power today for several hundred, just for all of us. So passionately, I was always perplexed because when I started Viacord, we were price, quality, and outcome transparent from the very beginning. And when we figured out what price we would charge, we looked at our costs. And we knew we wanted to be fair, so we'd charge the same price for the same patient family all over the world. So whether you gave birth in Singapore or you gave birth in Cincinnati next to our lab to bank the cord blood stem cells as an alternative to bone marrow for stem cell transplant, we charge the same price. And we figured, what is the absolute lowest price we could provide so we would have broad access? And so that's how the tech sector behaved. And for decades, that was 32 years ago. So for decades, it's perplexed me why we don't have prices in healthcare. And frankly, Rachel, it was 3 people that in the same week came to me 7 years ago that faced absolute financial ruin from getting healthcare. A breast cancer patient who lost her home and had to file personal bankruptcy, and I helped her come out the other side. A handyman who was charged $6,000 for a colonoscopy by his anesthesiologist. That was just the out-of-network anesthesiologist. And with his and his wife's combined salary of a little north of $100,000, they were paying $36,000 a year just for health coverage and their high deductible. And the third was a woman who was a nurse at Mass General, who was a colleague's aunt who came to me having a GoFundMe account before she could start her cancer therapy for proton beam. And she had $18,000 in savings that she put in and asked me to do the balance. And I thought, how is it that we are now thinking it's acceptable to have people that have coverage, have good jobs, to have such financial devastation and ruin, and to be taught to beg? And in that moment, I knew that I had sold my company, and I was blessed to have lived the American dream. And I knew to go to Washington philanthropically was my challenge, because I knew that the most important thing we could do is protect patients by having access to prices, by enabling this whole industry to compete on quality and outcomes and price, because it's the right thing to do. I mean, where else are we blind to no prices, blindsided by outrageous overcharges, and every time we get care, we have to sign with a blank check? And I'm here today so excited because healthcare price transparency is happening. It is the revolution in American healthcare because it is the catalyst that unravels that Gordian knot. And we're seeing it work, and it's at its very beginning. And people are being able to remedy overcharges just by getting access to the pricing data. And people and employers are able to save and create new health plans and new coverage that can lower costs. And so we're at the beginning, at the very beginning of what can be revolutionary and is and will be revolutionary in healthcare. And that's to flip the pyramid the other direction, put the patient at the very point of it, by giving us all the empowerment to be well-informed about our healthcare decisions on quality, price, and outcomes.
Right. So there are a lot of powerful industry players. The hospital industry spends a lot of money lobbying in Washington, and your advocacy campaign really has used strategies that run the gambit. They're not what we usually see. Certainly, you work with lawyers, you work with lobbyists, but you're also running Super Bowl ads, you're working with rappers, you're hosting concerts in DC for staff and members, and you're supporting painting murals in cities across the country. You're putting your message in the sky on airplanes. I mean, this is the kind of thing, it feels like an underdog campaign, and you're just trying everything you can to get that message across. So tell us, what's your thinking behind that strategy, and also kind of what's next? What are you going to try next to make sure Washington hears your message ahead of a critical stretch these next few months?
Well, we've had 3 presidents support price transparency. It goes back to the Affordable Care Act with Obama, and then the Trump administration actually found, and we worked strongly with them. We went in at the end of Obama administration, but we worked strongly with them to say, here are the existing laws that are sitting on the shelf to give us all the right to know prices, and they've never been made into rule of law. And believe it or not, they did move mountains and got it done within 6 months to make price transparency by hospitals, insurance companies, and pharmacy benefit managers all along the spectrum to be posted for all of us. That's huge. And then Biden, when he came in, he was frustrated that the Trump administration fine was so de minimis, and so essentially raised the bar, to make the enforcement provisions far higher, up to $2 million per hospital, to show all of the prices. So the one thing that was left missing was that nobody knew. There were no public service announcements. It's not like go get your COVID vaccine and the television's telling us to go be vaccinated every day. No, the Health and Human Services has not shouted it from the mountaintops. And so nobody, if you don't know you have the right to know all prices, how can we affect change? And many employers didn't know either. So we took to these unusual tactics. And we knew that, where Washington people go to the beach, and we thought, well, my husband's in the beer business, so we know what plane pools do for advertising. Yeah. So we can sell a lot of beer that way. And I thought, well, they can look up, right? Look up and see that prices are now your right. And that's what we want all of you to know. And I would say, I have two questions for the audience. And that is, first of all, how many of you, yourselves, or a family member, or someone you know, has been overcharged getting health care? Okay, for the ones of you that aren't raising your hand, it's probably another family member that's paying those bills. And how many of you knew coming into here today that prices are your right? Yeah, not everybody knows that we have the right to all actual prices in healthcare. So each one of us, for every point of care, we have the right to know that there is wide price variation when we go to get care. Even in the same hospital, it's been reported over and over again that prices can vary by 10 times. And so we see MRIs at somewhere around $300 versus well over $3,000. We've seen hernia repairs at $4,000 to over $40,000. Based upon your insured or carried plan, you don't know that maybe your health carrier is not actually negotiating a good rate for you. So this is huge because for the first time, it's eyes wide open for all of us to be protected, and we can actually compare our bills to the prices charged if we looked at those hospital files. That's huge.
Mm-hmm. Exactly. So I want to give you a chance to address some beliefs by some analysts in Washington, D.C. who believe that healthcare price transparency, even if we have it, isn't going to actually produce cost savings, save the healthcare system money. I think we've seen some analysts from the Congressional Budget Office that have shown, recent legislation that would codify price transparency for several different industries wouldn't produce any savings at all. But I think you disagree with that. So I wanted to. Can you explain why you have put all of your eggs in this price transparency basket, and some people believe it won't make much of a difference at all?
Well, I'd love to prove people wrong. So, one of the other things is the reality is it is working. It's all about the data. The truth is in the numbers. Mm-hmm. So when employers and unions that actually purchase plans, and let's be real. All of us, every American worker, pays for all of healthcare. We pay automatically deducted, usually 30% of our wages go right into paying for coverage shared with our employers. So we pay for our own coverage and our family's coverage. And today's paper in the Journal noted that it hit an all-time high for a family of four at $24,000 a year for health coverage. Okay, this is a huge amount. That's more than I made in my starting salary a long, long time ago. But if you look at where it is working, the employers that have gotten access to the hospital prices, the prices that their plans negotiated, and all of their receipts, which is the claims data, and they've looked at all of the providers and all of the coverage, they realize where they've been overcharged. And they create new design plans to save substantially. So I'll give you an example. Harris Rosen in Orlando, Florida, Rosen Hotels, over 6,000 employees, analyzed the data and created direct contracts with hospitals, front-loaded primary care, 24/7 for all of his employees. And his running cost for a family for 4 is well under $10,000. Less than, 60% less than what we see and what we're finding for the nation's average. Now, Osceola School District, one of the 8th poorest school districts in Florida, was in a $12 million deficit because of healthcare. Their school budget was going to healthcare costs. And they had 14,000 covered lives. They went to Harris and said, could you please show us how? They analyzed their data, they changed their plan, and within 3 years, they've saved $41 million by just getting access to these prices and putting that money back into the employees' pockets. So I look at what's happening. We know SEIU 32BJ in New York, 200,000 employees. They analyzed the pricing in their plan, and they found, no offense to New York Presbyterian, it's a great hospital, but they were way overcharging compared to all the other New York hospitals. They decided to carve them out of their health plan. Within 1 year, with 200,000 employees, steering their employees to other great quality of care, they saved $33 million. Year 1, $33 million year 2 and 3. That's now nearly $100 million that they gave the biggest raise in the history of the union, and each union member, all 200,000, got a $3,000 bonus, plus a 2-month premium holiday of no contributions into the plan. That's huge. That is how price transparency is working, and it's revolutionary. And you have to think about it. It empowers us. It shifts the power, empowering all of us to be able to be protected from overcharges, as well as to be able to, for the first time, lower our cost by being able to shop. And we do know once we have prices, people simply want to know, what am I going to get for that price? So price discovery ushers in quality transparency and outcomes transparency.
Excellent. I think we have an audience question.
Yes, we do, Rachel, right over here.
Hello, my name is Ali Christianian. I'm the CEO and founder of Expecting Better, a company working on fertility and basically trying to approach it for more of the preventative way rather than reactive. But I wanted to just ask a question. First of all, thank you for all the work you're doing. I think it's really commendable. In terms of pricing for fertility care specifically, from purely anecdotal experience, coworkers of mine have dealt with lots of lack of transparency when it comes to reactive fertility treatments, IVF, IUI, that come later after they've had these discussions with their employers, with the benefits packages that they've had in the works. And I just wanted to understand from your standpoint and from the process standpoint how that looks and what we can do to kind of take the onus off of the consumer and onto the actual providers and the packages that that they have and they're paying for through their employers.
Yes, I think the real opportunity is that all of us have the right to know all of these prices in advance of care. I mean, you wouldn't buy anything in any other market. You wouldn't buy a gallon of milk and expect it to be $5 and see it be charged $50 months later, right? So having that upfront pricing is really imperative to empower all of us, in whether it's your patients that are going through fertility treatments, it's the right thing to do to provide the exact actual prices. And look, estimates don't work. At the other end of the spectrum, so many in the industry have lobbied to not have actual prices, but just have estimates. And what we find is there's no accountability with an estimate. And when the insurers and the hospitals, as third parties, negotiate rates, they come down to a dollars and cents ability to price. The bills get priced in dollars and cents. After the fact, we're moving it up to in front of the curve. So we can have a functional and a competitive market economy that benefits the consumer, because then it's a race to the bottom. Look at LASIK surgery. LASIK surgery came way down in prices over time, and thousands and thousands more happened because it became very competitive. But when I look at how estimates don't work, we are all patient advocates. And I encourage each of you to be your own patient advocate and advocates in your own families. But when we each take on a case, we learn. And I'm going to tell you that in Colorado, we had a woman named Cindy who had a hysterectomy, and she was a 62-year-old retired school teacher because she had Parkinson's, and she needed a hysterectomy, and she was given an estimate that her out-of-pocket would be $500, and the estimate for her insurance carrier was $5,000. Well, she was sued by the hospital for $74,000, of which she could not meet, and the insurance denied her hysterectomy. And she came to us, and she had a lien on her home, her fully paid for home for her retirement with her husband. And she was desperate. And when we looked at the hospital pricing file for her insurer, we found indeed they did cover hysterectomies. And the range of hysterectomies in that hospital ranged from, with no complications, was between $3,000 and $8,000. Hers was at $8,000, not $74,000. So when she could take a picture of that file and picture of the codes on her bill, she wrote a letter to both the insurer and the hospital, and they both said there was a glitch in their system and forgave her debt entirely. That happened 3 weeks ago, and I'm very happy with that outcome. That's the empowerment of price transparency. If you understood what we see of the individual devastation from people that have done everything right to put food on their table, a roof over their head, not live on the dole, pay for coverage, pay for their family's education, and be totally harmed by the overcharges, it's devastating.
I do want to just make sure that we get to talk a little bit about the outlook in Washington, because the work that you're doing, you're bringing these stories to lawmakers, you're meeting with them, and there's a bill that you support that's been moving through the House. It has gained some momentum, has gained some backing, but it did suffer a setback, and the leadership in the House had to pull the bill, and it didn't get a floor vote that it was supposed to, which is a setback for the legislation. So can you tell us what you're feeling going into kind of this last stretch of the year? Do you think that progress can be made? And I guess, what are you hoping to see for a way forward?
Yes, I think it's revolutionary. They're calling it that this is the biggest healthcare reform bill since 14 years ago with the Affordable Care Act. So this is the biggest comprehensive bill that is in play, and it's really all about healthcare price transparency. And it's all about actual prices for the hospitals and the insurance companies to have this be codified into law even further, and for pharmacy benefit managers to start to do the great reveal as well, which are owned by the insurance companies, by the way. And this is really revolutionary. And the Senate is also having lots of action. In fact, there were two Senate hearings today that I was listening to in parallel to this conference. So there's a tremendous amount of momentum. And Rachel, you saw it. Today there were 4 articles, in major publications all about employers getting access to hospital prices and creating new plans to lower costs, about the egregious runaway costs of the coverage that is intolerable. And we just came out with an article as well in basically saying that what is the real opportunity here? Do you realize that the data of our country's healthcare costs is 2 times more than any other developed country, and we are paying over 2 times more to die 4 years earlier than the average OECD nation? And guess what? In the past 3 years, we dropped 2 years. So we're down to 76 years of age. The average is 80. And if you live in Singapore and Japan, you get to live to 84. We should be ashamed. We have the best innovators, and many of them here in this room are you. We have the access to the best care, and we can do better. Because right now, all of us are working 1 day a week. We're at nearly 20% of GDP, gross domestic product, of what is our country's spend on healthcare. Defense is 9%. We're at nearly 20%. That means for every of the 5 days a week we work, we're spending 1 day just working for healthcare. Okay? When we put those trends, how do we compete on a global scale? We cannot compete against Europe, Singapore, Asian countries when we are burdened with this overcharge. And so if you look at, there was a Journal of the American Medical Association article in 2019 that I just love, and it says that 25% of healthcare spending is administrative waste, errors, and abuse. So if you look at 25% of that spend, and we just got the prices, and we cleaned up the administrative waste, and we took out a lot of those middle players that are just capitalizing on our misfortune, we have the opportunity to readily save that 25%, and that's over $1 trillion a year. That's $1 trillion a year going back into school budgets, $1 trillion a year going back into our municipal, and maybe even the Boston roads would get rid of their potholes if we had more money for infrastructure and get our bridges built sooner. But that being said, we have this great opportunity of a great pay for, as we say in Washington, right?
Right.
And that $1 trillion is real.
Yeah. Well, thanks so much for sharing about your work, Cynthia. That's all the time we have for today. But thanks so much for taking the time to be with us.
Thank you, Rachel.